Good morning, everybody, or good afternoon. Very international group here today. We're gonna just give the attendees another 2 minutes or so before we get started, and then we get right to it. All right. Good morning to the group here from Atlanta and Chicago. Like I said, we have a very international group today, so good morning and good afternoon. We have some folks attending from Europe, some from South America, North America, which is great. I would like to welcome you to our actually 7th COVID-19 related webinar, which is a part of a series of webinars we started back in March to just give real-time, or as much as we can, real-time information regarding pressing topics around COVID-19. Today, we want to really focus on the next new normal, so reopening considerations, and looking forward to present to this topic today. My name is Joe Hayner. I'm heading the foreign direct investment practice for Jerry Beckett here in the US. So primarily deal with international clients here for the firm in North America. I'm very excited to welcome back Elke Rehbock as our co-host today. Elke and I are working together for many years now, serving clients here in the US and as a one-stop shop for their needs. And I'm always happy to have her with me on these webcasts. Elke, do you want to introduce yourself?
Sure. Thank you for that very kind introduction. My name is Elke Rehbock. I'm a partner at Dentons. Given my German background and some of my French education, I serve German and French clients in the United States and some US clients who look abroad. Joe and I have been working together on the inbound work and make a great one-two punch, and that is why we decided to team up on these presentations. Delighted to have all of you here. Welcome back for a good number of you, and welcome to those who are here for the first time.
Thank you. A couple of housekeeping items. We are trying to keep this webinar under 45 minutes. Try to be on point with our thoughts and our slides. If you have questions, please put these questions in the chat box. We are going to follow up with individual emails to address your questions specifically. The webinar and the handout will be available again for download probably mid next week, and you all will receive a specific communication. So we will provide a link which will make it easy for you to access the documents. Let's hop into the agenda. What are we trying to do today, and why are we having that webinar initially? So Elke and I received quite a bit of questions and requests around reopening, going back to business for clients and customers we serve here in the United States. So we thought it might make sense to share some of these discussion points and recommendations we gave our clients over the last couple of weeks with you who might be in a comparable situation right now, dealing with comparable questions. There's a lot of uncertainty right now. Questions around how to prepare workspace, how to prepare shop floors, how to communicate with your employees, your other stakeholders, unions, documentation requirements, government-related federal, state, local requirements for documentation, and all these topics need to be navigated through, and we want to see that we can share some of our thoughts around these topics with you today. Before we get started, I want to give a quick update regarding incentives. I will not go into all the programs already launched or in place or utilized over the last couple of weeks. We want to point out to that group because it's an international group that initially for the PPP loan applications and the related headcount, the requirement was focused on US employees, and that was changed. So the headcount number is now based on the international headcount of the organization, and that's basically applicable for requests sent in after May 5th. So that's a critical date for you to consider if you are, or if you applied for that program or received funds out of that program, to revisit the application. We also know that there are new support programs or packages drafted. It's not known, or it's not certain right now when or if they are going to be put in place. They are dealing with public health guidance topics around social distancing, workplace safety, and continued engagement from legal and policy perspective, meaning there will be some more input needed over the course of that launching that package. And then for me as a CPA, always important, specific tax breaks and tax considerations are also discussed, but nothing which can be confirmed or shared right now in this group.
Just one very brief additional note on that. The Federal Reserve released just last night additional guidance on the so-called Main Street program. We have not had time to digest this for the time of this seminar. We can say something more about that when we speak to you next, or in the meantime, reach out to us if you think that is something you would like to avail yourselves of.
Thanks, Elke. So unlike most other challenges, this is really a global challenge. COVID-19, coronavirus, it has global implications on the economy, and we feel that, and we advise our clients to take a global perspective on these topics. It is an issue for more than 177 jurisdictions. We receive a lot of calls and questions around supply chains, sales, revisiting distribution models, and also planning and mapping out options is even more critical today. So the plan or the strategy is certainly to see if we can help our clients, and our clients are trying to emerge out of that crisis stronger and more resilient, and also trying to optimize the supply chains, taking consideration future implications like another coronavirus pandemic type situation. Reopening consideration, there is no one size fits all approach. So unfortunately, there's no master plan which can be applied to any and all operations, any and all corporations, organizations. It needs to be tailored to the individual approach, the individual footprint, the individual customer base. More complicating to this issue is that these restrictions and the lifting of the restrictions are not the same in each area, so they are they vary based on nature and scope. There is also no uniform standard. You have compliance and regulation topics on a federal base, on a state base. If you are globally, you have to consider this on a country space as well, and that create significant challenges, specifically for multi-state businesses and businesses with a multi-state supply chain. So I have a lot of conversations with my clients, specifically in the automotive industry, because they have to consider going back, reopening their operations, but they cannot do this without their operations in Mexico if they're located here in North America. So kind of coordinating just these different parts of the supply chain is a challenge for organizations, and will be a challenge for organizations in the future. On the next slide, we just wanted to visualize the development roughly in the last 4 weeks since Elke and I had our last webinar for this group. So from a shelter-in-place perspective, you can see that since Monday, April 27th to basically May 26th, that most of the states here in the US reopened already, and reopening or considering to reopen, and we expect that this is going to continue. So the shelter-in-place situation is going to go away over the next couple of weeks, and companies and corporations are either started ramping up their production or planning to do so over the next couple of weeks. I'm going to hand it over to Elke. She's taking us through the next couple of slides and giving us a bigger picture of the situation.
Thank you, Joe. So the point Joe just made goes back to a very, very old saying, and that is that change is the only constant in life. Funnily enough, that saying was first made 500 BC, and I couldn't say that it is more accurate than ever today. One of the challenges we see is that if you look back to the prior slide and see the shift in color from opening up, there's a good chance, depending which statistic in which forecast you believe on, is that we might be opening up the entire United States now. Certain states which have forecasts that are worse than others, Illinois is one of them. Apparently, a good number of bad things are still to come here. We might be closing back up a few months from now. We'll have to see how exactly that plays out. But for you as employers running a company, that bears significant challenges. First, I think it bears a significant challenge for your compliance program. The one most important thing your compliance program needs to address at the moment is how to actually deal with change. So not only do you need to address the points that we will go through, but you'll also have to figure out how often do we check in with counsel, how often do we check in on new incentives Joe could help with, to see that we capture all of the benefits, but also are in line with all of the ever-changing regulations. Do you need to update your employment handbook, your other written policies? And on that end, with your employees, communication is absolutely key. One of the things that many clients are considering is a welcome back to work kit, which is, other than it being a nice thing to do, an easy way to make sure each employee has updated policies on their desk and has been communicated with in one way or another. The requirements, as the slide says, will show up in each area of your company. It will be just in how do you physically actually run your business, which is what Joe talked about on the supply chain. We'll get back to that a little later. Employment laws, how do you keep your workplace sanitized, et cetera, et cetera. One way to keep up with all of this is to look at online resources that are available to you, and there's many that are actually for free. My firm offers a number of them, starting with the 50-state survey. We started this survey a while ago to capture shelter-in-place orders. It's obviously been updated to track reopening requirements in the 50 states. It gets updated twice a week to be sure that twice a week we have the then current information. We also have an employment law tracker on our website that you can look to, and that answers initial questions on legal requirements in the United States as well as elsewhere in the world, should you have to make workforce related decisions. For the US, we're putting together an employment law toolkit. Email me if you'd like a copy of that. It's about 15 to 20 page document that answers the typical questions in a little bit more depth than what Joe and I can cover here. So going back to how to actually go about this, the next new normal is what we call this presentation. You'll have to prepare your workforces and your workplace to be ready. We just touched upon this. We have to all develop a strategy to address and stay up to date on key issues. We'll say a little bit more about having a task force so that the work that has to go into the related compliance is centralized in one body and uses one set of employees and is not scattered around. That task force will have to monitor state, federal, and probably local regulations really closely and deal with ongoing compliance and related updates. Joe, back to you.
Great, thank you. So how can that be achieved? How can this be addressed? We're going to try to cover these topics at least high level in this presentation, and then if you guys have any additional questions, please feel free to reach out to us to have a more in-depth conversation based on your individual situation. So reopening considerations, first and foremost, it's imperative that you think about the strategy and the key issues for your organization specifically before you reopen. And I know this is sometimes challenging because everything is moving so fast, and we were talking about communication. I'm sure you receive a lot of different communication, and you have to go through that and see what is applicable to your organization, to your specific situation. So that can be one of the challenges which can be addressed by a reopening task force who goes through all these documents to basically filter out what is really relevant and what is the relevant standard for your organization. Elke touched on that, COVID-19 recording and reporting requirements. That's something to keep in mind. What can you record? How can you record it? What's a requirement? How is this information to be kept? Confidentiality. What rules and regulations have to be considered when recording this information about your workforce? Then going back to your policies, you really have to. Most of the policies I saw so far, they have not specific documentation or guidance around a pandemic situation or specific benefits you might have put in place now temporarily for the COVID-19 situation, or benefits you have to provide due to changes in regulations which need to be reflected in your policies. Then communication, Elke alluded to that topic as well. Communication in regards to cleaning procedures, disinfection, what guidelines do you have in place regarding social distancing? What are high-touch areas in your organization? What kind of personal protective equipment can you provide and is necessary in addition to what you already have? Communication about what happens with the health screening data. What's your strategy around that? And communication is not only to your employees, it's also to your external stakeholders, like working with unions, maybe suppliers you work with, customers, governments, to show you're on top of these topics and you develop a strategy based on what makes sense for your industry, but also what is or has been communicated from the state and from federal agencies in regards to what needs to happen in your workspace. How can this be done, or what is a possibility for reopening a task force? I put here on this slide an example how some of my clients address this topic. So they basically identified and some of the stuff you might have already done. Some you might be able to do right now and put in place over the next couple of weeks in preparation of ramping up. So basically identify key employees, have your tight group of task force assigned, normally sponsor from management, you have operations people, HR, legal people. Sometimes you have to bring in, or it makes sense to bring in outside consultants to help with certain areas, because you might only need that task force for a certain amount of time. And if you bring in outside consultants, they are only there normally temporarily. Be decisive and smart in your decisions. React timely. That's the reason why you have that small group, which then advises management or has a direct management function for that specific time frame. How can you approach a strategy which the task force can develop? You can work with dashboards. Normally, my clients have different data sets they can tap into, but sometimes nothing really streamlined in one tool. So what they consider is bringing in a tool so they can visualize data structures, inside data structures, and then also lay over external information about, okay, what are certain developments, for example, in the United States, in specific states in the United States, how can this be tracked? For my clients, we set this up on a real-time basis, so the data gets into the system in real time and provides certain dashboards for the decision makers of the organizations to make good decisions on the basis of the current data, and be able to react quickly on changes. Furthermore, most of them are looking into scenarios. So we know now that the shelter in place in the US is probably going away. What we don't know is there going to be a second wave? How long does it take to put a vaccine in place? A lot of unknowns. So being able to run scenarios about most likely developments in the future is certainly an advantage. A reopening task force could also cover. On the next couple of slides, Elke is taking us through some compliance-related topics.
Thank you, Joe. Just one more note on what Joe just said is the considerations that he went through are important for each one of you to the extent you sit on corporate boards. If you're a corporate board member, to fulfill your fiduciary duties, your duty of care, you should ask those questions. Has management considered all of this? What are the scenarios? What's the best case? What's the worst case? How are we planning? How are we doing financial planning, et cetera, et cetera. So it's not only relevant for you as a member of management, but to the extent you serve on any other board, you can use what the materials Joe just walked you through for those considerations as well. Back to compliance issues. So the general duty clause of OSHA essentially guides us through this, through these considerations. That general duty clause requires that an employer provide a place of employment that is free from recognized hazards that are causing or are likely to cause death or serious physical harm. It's as if that was written for COVID-19, which it isn't, but that is how it reads today. So we touched on many of those considerations earlier. Let's dive into some with a little bit more specificity. OSHA recommends that companies develop an infectious disease preparedness and response plan, including the bullets that we've listed here. Can you improve the ventilation system where you are? How do you address physical distancing? If you have an open space office, that will look differently than if you are a manufacturer and you have to think through how close people can be on the floor. What do you do in terms of screening? What do you do for visitors? Do you even allow visitors from the outside world to come to your space? In all of that, the CDC guidelines should be helpful. It is always the case that to the extent one complies with legal guidelines that are given, like those from the CDC, you have a good defense should anyone ever complain about what you have done and the care you have given. When you think back to the pace of the change that we've seen, very unfortunately, this is not a one-time undertaking. This plan will need to get updated as CDC guidance changes, as the world has a new and better understanding about how this virus gets transmitted. Maybe 6 feet is 8 feet one day, maybe 6 feet is 3 feet one day. So we just don't know yet where this is going to go, and we just have to stay nimble. Screening and questionnaires is another issue we wanted to talk about. It's interesting that this virus brings us to a cross in the road between what OSHA requires and what we typically perceive as a risk for discrimination. So we're supposed to provide a workplace, a safe workplace. That's the short of the OSHA rules, which means that to a certain extent we have to single out those who are most at risk. And we have to treat those who are most at risk possibly differently. The ADA came out with guidance permitting employers to address this. So you can make, in certain circumstances, and should you go about doing this, do check in with your in-house legal departments or with your other advisors to make sure you are within the scope of those rules. To be sure that you can properly treat different age groups differently, because COVID-19 treats different age groups differently. I'll leave it at that. If it's not to say that in all of those judgment calls that will have to get made, I would tend to be incredibly conservative, because the last thing anyone needs is a lawsuit about any of those issues. Those will come, and you just don't want to be the first lawsuit that's out there.
Yeah. Just a quick note to the compliance topics and infectious disease preparedness and response plan. I would like to add that it's important to document why you undergo certain measures or why you do not undergo certain measures, so that there's a documentation about your reasoning, and this can be discussed with your legal team, and also be a documentation in case there is something coming up down the road, that you can make sure that you underwent a certain thought process in applying the regulations. So for example, one of my clients, automotive supplier, they had traditionally a shift layover. So if there was a shift change, there was about a 15 to 20 minute layover between the team leaving and the team taking on the next shift. And the client managed not to conduct these layovers anymore to minimize contact between these workers and interactions to be in compliance or making this in compliance with certain regulations. Like I was talking about screening and questionnaires. So what is typically happening? So what we see is that most companies start taking temperatures and asking questions about symptoms. There's information available also from the CDC, what are the typical symptoms, which then would be the questions which would be asked, and then respectively documented that you ask these questions to certain employees, so that you have that in file along with temperatures as a kind of a very basic layer of screening you can do. The health screening results must be treated in accordance with other medical records, so they must be in compliance with ADA. So you really need to make sure, because now you have a big volume of information coming in. How do you track it? How do you document it? And how do you make sure that only the people who are supposed to have access to that information have the access to it? How do you store it? And so forth is a topic you need to take into consideration, so you also can go back and prove out that you screened that person who maybe gets sick at some point in the future. Okay, it's taking us through some more recording and more specific recording and reporting regulations now.
So again, when you think about your own internal policies, consider what OSHA has to say about this. They literally just came out with new guidance that went into effect on May 26th, that requires recording of all COVID cases that fall into the buckets listed below. So that also means that you have to have policies in place that allow you to obtain the information that you are supposed to record. I won't go into a lot of detail about this. We've spoken about some of this already. Note that if you have an employee who's been diagnosed with COVID-19, you have to let the other employees know. Obviously, you're not going to single out Elke and say Elke had COVID-19, because that is medical information that you're not supposed to share. Now, you cannot control the office chatter, even though social distancing might control that a little bit. But you as the employer need to be very careful in how you communicate this and how you allow your existing employees who might have had contact with someone who was infected to take appropriate precautions. So beyond the person who has been diagnosed, allow those who have been in contact with that person to react. And
I would add that communicating your approach around how you handle these cases to your stakeholders is certainly also helping with transparency around, okay, employee thinks, okay, what's going to happen to me if I get diagnosed with COVID-19, to know what the process looks like in the organization, how it's going to dealt with, that they're not singled out, they're not, the name is not going to be publicly available, and what the process is to work with them through that infection, but also then, in addition, what happens to the other workforce, how are they be protected from diagnosed employees, diagnosed colleagues, so that they can feel safe in their working environment and perform the way they should perform based on the requirements of your organization. The next slide, I just want to give a brief overview about PPE. Most of you at least the folks working in production environment, myself being a CFO or have been a CFO for many years in the marine space, PPE is not unknown for most of the industrial manufacturing group, and it just needs to be understood there's a different layer now, and there might be different requirements also for your organization in different states, and even in especially in different countries if you have a global organization. So OSHA provides some guidance around PPE by risk category. There's some guidance around what type of facility you have, what type of what jurisdiction you are in, and yeah, you might want to comply with that OSHA regulations. Some of my clients, they even take it further and introduce a different or an additional layer of protection they feel appropriate for the organization. So certainly what OSHA is recommending is probably the baseline, and there is opportunity for you to introduce different layers of protection if you find that helpful for your organization. Moving on to discrimination, privacy, and data security, and Elke is going to take us through these couple of slides.
So we already touched upon the fact that medical information must be kept confidential. You have to secure it in a reasonable manner that's appropriate for the nature and the sensitivity of that data. That will be new for those of you who have not dealt with a lot of situations like these. If there's any questions, reach out. You should think about who has access to this data, where do you put it on your system, and so on and so forth. The one thing many people forget is there's a host of other laws than just the typical ones that pop up under medical information, such as biometric privacy laws. If you take someone's temperature, certain methods use biometrics to do that. And in Illinois, where I sit, that would kick in the Illinois Biometric Information Privacy Act. And that has pretty drastic consequences because it is a per person violation, and that can get expensive really quickly. There are also notice requirements to the extent you want to take someone's temperature. Those vary from state to state. Relatively harsh and strict requirements exist in California. It just goes to show that you have to check your requirements locally. Many of you operate in different states, back to the not one size fits all solutions. Just a really brief note, obviously, we continue to have to make reasonable accommodation under the ADA for disabilities. There's a debate at the moment which additional disabilities might get recognized under this time, in this time, and which accommodations have to be made. And again, religious accommodations continue to be required, and you'll have to discuss the request and provide notification to the extent that is reasonably feasible. It's a case-by-case analysis, as it has been in the past for those considerations. And I'll hand it back to Joe with that.
Thank you. For reopening considerations, we also want to give like a brief overview of examples we see. Some of them you probably have already thought of or put in place. Some of them might be new to you. Just wanted to provide some bullet points here to give you some ideas what can be done. So touchless entry systems, controls at elevators is a possibility. You can have these plexiglass barriers, which I've seen put in place. Some offices actually rearrange the way the corridors are used so that you have more space walking through the corridors if you have it as a one-way. they space tables in lunchrooms or close lunchrooms as not being usable, so people take their lunch at their desk, which is already spaced appropriately between the other co-worker. You could remove chairs in the conference room if you still conduct conference, if you still use conference rooms. A lot of companies now are using GoToMeeting, Zoom, Teams, other online possibilities to conduct meetings. So that might not be a real topic for a lot of companies anymore. And then at some production facilities, especially in the South, you have already lunch facilities outside, so you can use that more to minimize the exposure to between employees. This brings us to the end of our webinar today. We mentioned that a couple times now, so one-size-fits-all approach doesn't really work in that situation. However, we see and we feel that the situation can be managed appropriately by using technology to run scenarios, by bringing in experts to help with developing new policies or addressing the change, staying up to date with change, putting in place the right documentation to show if someone is going to review what you did, what you put in place and why. If you're a board member, like Elke mentioned, make sure that you ask these questions to the management. If you're management, make sure you are transparent with your board, what you put in place and why, and document it accordingly. Unfortunately, there is only very little federal or agency guideline out there right now. So Elke and I are hoping that this is going to change over the next couple of weeks. And until then, we are happy to support and share our knowledge and experience with you guys. And yeah, hope you stay safe. Elke, do you want to share some closing remarks?
I think you've covered us. Thank you so much again for having me. Everybody stay safe, stay healthy, take good care of your families, and we will see you on our next webinar.
Thank you. Have a good day.